So I'm the communication, less the classroom side of things, and I'm going to be talking about not so much the psychological effects part, but the lack of access today. This is stuff that I got interested in during my postdoc, or I should say as a function of my postdoc. I did a Robert Wood Johnson postdoc, which was focused on health and health disparities. So as a communications scholar before coming here, I was interested in whether or not we can create technologies, which many people, even in this room, may be interested in, creating technologies to improve the lives of low-income people through increasing social support, which is good for health. So I was working on this project where I was intending to do an intervention in public housing neighborhoods throughout New York City where I was living at the time. But I thought before I do that, I was going to use texting. So I thought texting, everyone's got phones, not everyone, lots of us have phones, including people living, the low-income populations, people living in public housing. But let me get a lay of the land. Let me get a sense of how these people actually are using technology in the day-to-day as it is. What is the relationship to phone and cell phone use? So I went into lowest income census tracts throughout New York City, which in New York City, given the cost of living, means people are living in public housing. So I went in trying to ask people whether or not they're using their phones for health and safety, and then does your cell phone help you feel connected to people in your life? Do you have a relationship with your phone that you're already kind of using your phone in this way, to see if I could kind of build upon that? So what I'm going to be going through now, I ended up, with the help of some amazing research assistants, interviewing about 30 people. I'm going to be talking about qualitative work here. So first study interviewed about 30 people and asked them, among many other questions, this question, but for time's sake. And I'll read you some of the quotes I got. So this was a quote in answer to, again, so the question, does the phone help you connect? And one person said, yeah, I miss it when I don't have minutes and I can't afford to buy them. But today I put $10 in one of them and the other one turns on the 13th. I feel naked. I feel like, wow, gee, I need to talk to somebody. There's nobody, And when I don't have my phone on, I talk to my cat. So this was one of a few really striking quotes where, this is the beauty of qualitative work, which I was really new to. I didn't go in looking for this kind of built-in disconnection, but this is what I started to see, evidence of what I ended up calling technology maintenance. And this is this idea that I'm trying to play with, which is, as the initial access divide closes, now we've got about 84% roughly of low-income users, I think that's in the US, have a cell phone. And 75-ish% are online, but they still struggle with using technology that's broken, borrowed, dependably unstable, right? So I could give you many other quotes in this study that really evidence this kind of scrappling together of access when it was getting disrupted in a regular way. And so then I thought, well, gee, this is really interesting. I'm going to now do another study where I really delve into this question and look at, okay, what are people's experience of this kind of technology maintenance? And then specifically this dependable instability, this expectation that, yeah, my phone's just going to be off a few days every month, or, yeah, I have a computer, but it doesn't work all the time, and when it gets a virus, I can't fix it, and that's just part of my experience of technology. What are the consequences of that? Is it happening, and what are its consequences? So to really dig into that, let me stop and say really quickly, part of the reason this is so important, this is a graph from the CDC from just a couple of years ago showing the increase in mobile-only homes. So percentage of adults and children living in households with no landline telephone. This is across the entire US population. For low-income houses, this is now over 50% of homes, which means that if people are kind of just casually mentioning that their cell phone is off on a semi-regular basis, those same people means that they're going without any telephone access. So when their kid's school needs to call, or they need to call their doctor because they're disproportionately sick, or they need to call their social service worker to re-up their food stamps or whatever, they're just going without a phone. So there could be some really serious consequences to this. So interviewed clients and some staff, but I'm going to focus on client results, at Volunteers in Medicine, a local free clinic here in Bloomington, and then a Positive Link is a HIV clinic that primarily serves low-income clients. And so what are some things I found? Quotes like this. This was a client's response about how disruptions in cell phone affected their use of healthcare. She said, if I have my cell phone on, then I can call the pharmacy and say, is my medicine in? HIV patients take lots and lots of medicines. They'll be like, yeah, your medicine is in, ready to pick up. Whereas if I don't have a phone, then I have to walk there or go on a bus. And when I get there, tell me it's not there, and then I have to go back home. She didn't have a car. So what I really ended up finding, give me one second. Sorry. How am I doing?
You're almost back.
Yeah, so I'll skip this one. So what I ended up finding with healthcare, this wasn't disrupting emergency care, but really just slowing access to care. What was really interesting is I was focusing on healthcare. What really upset these clients was disruptions, there's my own timer, in things like, I'll just stop with this quote, things like employment, disruptions in access to employment. So multiple people said things like, since I don't have minutes all the time, employers can't call me as much, and if they can't get a hold of me and they're gonna call somebody else to do the job, that's where I feel lost. So it actually gave me instances of missing out on work because their phone was off by the time they get back on, they've lost the job. There were disruptions in social support systems, as you can imagine as well. So I'll just end by saying this dependable instability is slowing delivery of healthcare, exacerbating unemployment, and disrupting social services. I'm happy to talk about future steps with this project, but thank you for your time.